I like to do manipulations on students so that you guys can kind of feel what I'm doing, because it's hard when you're just looking.
Okay.
And so I'm gonna do some on you so you can kind of see like the pressure I'm doing and the kind of stuff that I'm doing.
Okay.
Do you have pain anywhere?
No.
Okay, so first thing I do is I start by looking at my patient. I look at shoulder heights. So that's what I told you to do during like the shoulder exam I gave you guys. And so it's minimally a little bit elevated here compared to this side, but nothing substantial. So I'm gonna feel down on your first ribs, and so it's a little elevated on this side. So you feel how like it hurts a little bit more on this side than this side. So that's the first rib that's elevated.
Okay.
And so then I'm gonna come, so your spinous process is right here. I'm gonna come over, so there's this little dip right here. You heard me mention that yesterday.
Yes.
That's your transverse process. So you can you start at the top and then you work your way down. And you're looking for differences on one side versus the other. And so can you feel yourself how this hurts more than this? Like it feels tighter here.
Yes.
So this is an area of treatment for me. So then I come down to the base of your sacrum. I'm gonna feel on your iliac crest. You follow the iliac crest around to the PSIS. And so put your fingers on the PSIS, and I'm just lightly touching here. No, not you.
Okay.
Go ahead and bend forward like you're gonna touch your toes, and then come on up. And then so my left thumb went higher up. That tells me that there's an issue on your left hip, and that's what we're gonna look at.
Okay.
So go ahead and lay on your back for me. Can you get up here? Do you want me to push it down a little bit? There. Lay on your back.
Okay.
Yep. Those things are. And the other thing you want to do is, I'm gonna actually take these off. So you want to check a neck when a patient is laying down. So you're going to turn your head, and then you're always gonna, so this is rotation, and then we're gonna check side bending. Your neck is actually pretty good. And then when you heard me mention translating, so you find the spinous process, you go a little bit over, and you're literally just trying to relax your head. Try and this is what translation is, how I'm pushing back and forth. And I'm looking to see if it's stuck going one way versus the other.
Okay.
You're good. Okay, now put your head in this little hole here, and then we'll work on your hips. Okay, so you're gonna bring your leg up here, and you're gonna bring your leg up here. Go ahead and pull your knees apart. Good. And then you're gonna push your knees in. Good. And then you're gonna pull apart. And then you're gonna pull in. Good. So this is what I call a shotgun treatment. So this is actually fixing your pelvic bone. So if you're concerned about a pelvic abnormality, use the palm of your hand to feel where that pelvic bone, because it's right down here.
Okay.
And then you'd feel on either side. And so it's a little painful for you on this side, yeah? Compared to this side?
Yeah.
Yeah.
More tender, yeah.
So that means that we have something going on with the pelvis. So we'll fix the hip, and we'll see if it kind of fixes that.
Okay.
So I'm gonna pull this leg off the table here. Scoot a little bit to this, closer to here. Good. Okay. So I'm gonna have you push your knee up against my hand. Good. And relax. And then we're gonna bring this leg out just a little bit more. And then go ahead and push up again. And relax. And we're gonna do that one more time. Push up. Good. So now you scoot back towards the middle there. Good. And then we're gonna recheck on your hips, and that feels a lot better. So then we can recheck on your pelvic bone. So it's still a little bit up there. So like if you were having pain, we could work a little bit more into that, but we don't really need to.
Okay.
I'm gonna have you flip over onto your stomach.
Okay.
The biggest thing I want you guys to feel is myofascial release, and like the depth that I am pushing on your back, so you know kind of how to do it on another patient. And I always bring the table down because I can create more force and more leverage this way. Okay, so we feel that there's definitely some tight muscles down here. So when I'm doing myofascial release, I am doing a downward direct pressure. And I am holding this until, keep breathing, until I feel it get softer under my hand. So I'm gonna tell you when I feel that, and I want you to let me know, did you feel that release? So there's a little bit of a release there. Did you feel that?
I did.
Yeah. So that's what you're looking for when you're doing that in a patient. So when I am treating a rib, I think you saw me do this yesterday. So I'm going on that lateral rib angle, having the patient bring their arm off. And so do you feel how it kind of got harder under my thumb there? Like you feel that gut
The
tensor?
notch? Yeah.
Yes. That's what I'm feeling when I'm bringing your arm up. I'm bringing it till I get to that point.
Okay.
So then I'm pushing down and lateral, and you're pulling your arm down. So go ahead and pull your arm down. Stop. And then pull again. And stop. Good. That feels better. Good. So you had a couple things going on. I'm just glad you're not feeling discomfort from it. Okay. Okay. Go ahead and stand up. So that's just a little example of kind of what manipulations feel like. Does it feel any different? Ooh. Ooh. Wow. Yeah. Okay. Sometimes people tell me they feel taller.
I haven't felt so long.
I don't know what that means, but I say that. You must stop recording.